Hi guys, Dr. Ladner here, double board certified facial plastic surgeon, and welcome back to our educational series. Today's topic is brow lifts. What are brow lifts, and am I a good candidate? So a brow lift is simply that, otherwise called a forehead lift, which is not always synonymous, but those two are used very commonly as the same term. So a brow lift really kind of takes over where a facelift stops. So what do I mean by that? A facelift, as we say, in its purest form, is going to naturally rejuvenate the upper cheek area, the lower cheek area, and oftentimes includes the neck lift along with it. When we do a facelift, we don't get any rejuvenation of the upper 1/3 of the face, which is where brow lifts can be very powerful. So who's a good candidate for a brow lift? Brow lifts we can do really in all ages, so you don't have to be 65 years old to qualify for a brow lift. Many of my patients are actually in their 30s or 40s for brow lifts, and that's just because they've always felt like their brows are very heavy, pushing on their eyes and creating shadowing and darkness to their eyes. So a good candidate in this particular case is someone who wants to just naturally lift up the eyebrows to show off that beautiful color of the eye. Another good candidate would be someone who over time has noticed that the eyebrow on the forehead truly has started to lower itself, it started to sag, and it's creating the appearance of extra skin on the upper eyelid. I think what a lot of our patients don't realize is that sometimes, and to be quite honest, probably more times than not, most of my patients that think that they need an upper eyelid surgery are actually going to be better candidates for the eyebrow. It's going to give them a more natural, more rejuvenated appearance than if we were to take out extra skin of the upper eyelid, which could leave them hollow if it's the fault of the eyebrow. Eyebrow lifts can be done in many forms, but I truly believe that whatever form we pick, we need to do something that is going to be long lasting and give duration to the procedure to justify it. Endoscopic brow lifts, to be quite honest, were really in vogue about 20 years ago. And what that meant was we'd make small incisions behind the hairline. The problem with an endoscopic brow lift, that's all that's done, is that we're not removing any skin. And so what I found was those results really just weren't holding up. So with my unique technique, we can combine endoscopic methods during the procedure. However, I truly believe that some skin almost always needs to be removed to make the results actually stand out and last and also account for asymmetry. So I love to do a post-trichophytic, just right behind the hairline incision, wavy incision that allows me to control both the muscle as well as the skin and get them that nice elevation of the eyebrow to really open up their eyes and know that that result is going to last and to get better balance between the two sides if they're uneven. And that's it for today's teaching. Hope you enjoyed it.